Now, what is the difference between a panic attack and a panic disorder? Now, with a panic attack, you might experience this intense sensation or feelings of fear, which is beyond proportion of what's normal. This is usually an emotional response to a perceived threat. And usually when you have this intense surge of fear, you would experience other symptoms such as palpitations, feeling sweaty, shaky, trembling, chest discomfort, nausea, abdominal pain, feeling short of breath that you cannot breathe, and you feel the symptoms are getting worse and worse and worse for about 10 minutes, and then maybe after 30 to 45 minutes is when you start to calm down. Whereas a panic disorder is when you're actually experiencing recurrent episodes of panic attacks which are not expected. There is no particular trigger, there is nothing in the environment that has actually caused panic attacks to take place, but it just happened for no specific reason. As a result, you might try and modify your behaviors to try and avoid these panic attacks. It could be coming to the office to work, it could be going to see certain people, or just being in a crowd of people you're trying to avoid. And a lot of people with panic disorders tend to stay at home more frequently than they should do. This means that you're not able to function on a day-to-day basis. You cannot go to the shops to do shopping, you cannot go out to see friends or relatives, or even going out for drinks to the bar or restaurant to eat. You cannot even drive your car because you feel anxious just on driving and you're worried that you might have another panic attack. In terms of management, it's very important that you get the help that you need. Self-help is usually recommended. By self-help, I mean just look for support groups, people who've had similar experiences who have had panic disorders or panic attacks. Do not underestimate the power of exercise. Exercise is very important. Exercise is actually a good calming remedy for panic attacks. Also, talking therapy in the form of cognitive behavioral therapy is what's recommended to help manage your panic disorders, to give you coping strategies and increase your resilience for dealing with panic disorders and panic attacks. And then if you're thinking that, okay, maybe I'm not really someone who likes talking therapy, I'm not someone who really exercises for whatever reason, you might benefit from medication, then there are different types of medications that can help with panic disorders. So in terms of the physical symptoms that were mentioned, the palpitations, the trembling, feeling hot or sweaty, propranolol, which is a beta blocker, is a medication that can help with panic attacks, and that can be taken on a short-term basis or as and when needed. So it's not something that you feel you might have to take every day. It's something that you can take maybe 2 or 3 times a week if you have a recurrent episodes of panic attacks. But the first-line pharmacological treatment are called the selective serotonin receptor inhibitors, known as the SSRIs. You have your sertraline, citalopram, acetylopram, paroxetine, and then you have the selective noradrenergic receptor inhibitors such as the venlafaxine, and these are all licensed for dealing with panic disorders. So I hope you've understood this short video on the difference between panic attacks and panic disorders. If you have any questions, please feel free to drop some comments below.